Here's a good question. Has private interference in the NHS actually ruined the chances of the system being privatised for good? I say this on the back of a public survey that shows that satisfaction with the NHS is now at a record low. I'll go into that in a moment, but privatisation, according to the great thinker Noam Chomsky, depends on a few things. First of all, you defund the service you want to privatise, you take money away from it. Then public satisfaction falls, you say it's not working, and then you privatise it. But the problem with the NHS at the moment is that they introduced privatisation first. All those other criteria are now in place, as you can tell from the discussion on the BBC's Politics Live. First of all, here's George Monbiot to talk about defunding.
The fundamental problem is a huge funding deficit. Worldwide, a modern health service requires year-on-year increases.
It does
4%,
get year-on-year, 4%, right? Yes.
Above the rate of inflation, just because of ageing populations and because of technological change. For the entire period of the Conservative government, it was below that, except during the peak of the pandemic, when clearly there was more spent. According to one estimate, the total funding deficit from that period is £200 billion. This is why the NHS is falling behind. This is why waiting lists are as they are. Dentistry's got this whole other problem, which is this crazy units of dental activity formula, which means that NHS dentists lose out and lose out. I'm afraid that's a Labour legacy. Neither party really comes out well from this. We desperately need to see those funding shortfalls plugged.
That's one heck of a deficit. £200 billion run up by the Conservatives over their 14 years in office. And now here's a former Conservative advisor, Mercy Muroki, to explain what that shortfall has done to services.
For me, I recently had an experience where my daughter was referred to an NHS dentist because she needs a procedure under general anaesthetic, and she was referred from a private dental clinic to the NHS. When I called up the NHS, they said, we'll offer you an appointment in 12 to 18 months. And then we'll put you on a waiting list. So if this is the kind of quality that people are having to encounter in the NHS, of course only 1 in 5 are going to be satisfied with it.
And what happens as a result? People get angry. And you can see their anger displayed in the results of the satisfaction survey, quoted by Jo Coburn here.
We can have a look at the graph, and you can see once it reaches its peak, it then sort of drops off a cliff. You can see 19% satisfied with A&E, accident and emergency, compared to 54% in 2019, 20% satisfied with dentistry compared to 60% in 2019, and 31% satisfied with GP services compared to 68% in 2019.
Right, so the next step in the process would be to hand the system over to private equity. But there's just one problem. Private equity has been in the system since 2012, and that is considered to be the reason the system is falling apart. And the figures show this. When David Cameron's Condemn coalition government took over the running of the National Health Service, it was ranked as the fairest, most efficient and cost-effective health system in the world, and had its highest ever public approval rating of 70%. Then Cameron's Health Secretary, Andrew Lansley, inflicted his Health and Social Care Act of 2012 on us all, inviting private health companies into the system and turning it from one devoted to maintaining our health into one determined to profit from our illness. And here's what happened. Privatisation diverted NHS resources to profit-driven companies, increased inefficiencies and eroded public trust. Instead of improving healthcare, it worsened access, affordability and quality. Private healthcare providers attract NHS staff with better pay and working conditions, worsening the NHS workforce crisis. The NHS now struggles to retain doctors and nurses, leading to longer waiting times and poorer patient care. Private companies focus on less complex, high-profit procedures, so cataract surgery and diagnostics, leaving the NHS to handle costly, complex and emergency cases. This weakens the NHS's ability to provide comprehensive care and increases the financial strain. Private contracts introduce administrative costs, legal fees and profit margins that drain NHS resources. Outsourcing services like cleaning and catering has also led to lower standards and increased infection rates. More NHS patients are forced to go private due to long NHS waiting lists, fueling a two-tier system. This benefits private providers while worsening NHS accessibility. And private providers often operate under different rules, limiting public scrutiny and accountability compared to NHS-run services. When private providers fail, NHS patients suffer the consequences. And that is why public satisfaction has plummeted. The results of the privatisation craze were most strongly seen during the COVID-19 crisis and in its aftermath, and we can see that reflected in the results of the survey. Since 2020, the NHS has laboured under long waiting times for hospital and GP appointments, staff shortages, and perceptions of insufficient government funding. Satisfaction with accident and emergency services dropped to 19% in 2024. Despite these challenges, public support for the founding principles of the NHS remains strong, with 90% of adults supporting the provision of free care at the point of use, and 80% favouring its funding through taxation. But Health Secretary Wes Streeting is deep in the pockets of the private health industry, having taken donations worth £175,000, more than his MP salary, in a single year, 2024. In total, it seems he has received more than £311,000 from such sources since 2015. These donations have raised concerns about potential conflicts of interest, especially given Streeting's advocacy for increased private sector involvement in the NHS. Critics question whether such financial backing influences policy decisions related to NHS privatisation. So we seem to be caught between a rock and a hard place. After more than a decade of privatisation-wrought devastation, it seems Labour's prescription is more of the same. This is the very definition of madness. No wonder there are no plans to improve mental health. And that's all I have for you now. Please like, comment and subscribe, and I will definitely be talking to you again in the next one.